Hi, I'm Abbey. It's nice to meet you. I'm just doing my rounds here at the hospital, okay? I've heard that you're feeling a little bit under the weather. Okay. And do you want to tell me about your symptoms? Okay, sneezing and coughing. Okay. Okay, a bit of a runny nose. And are you finding that you're coughing just a little bit? Quite a lot? Okay. And are you finding that there's any phlegm? Even if there is it just a clear colour? There's no green colours or dark browns or anything like that? No, that's good. That's a good sign. So it seems like you have what seems to be going around at the moment. There's a bit of a cold and flu vibe. So I'm going to take a quick look at you, okay? I'm just going to pop on some gloves. Now, how long have these symptoms been going on for? A few days? Okay. And what did it start with? Right. Okay, so it's just the same sort of runny nose. Right. Okay. Just trying to pop on my gloves here. That's better. So I'm just going to do a little bit of a quick checkup just to make sure that everything looks fine and you're not coming down with anything like pneumonia if you're coughing quite a lot. And then we'll send you on your way. Alright, so what we're going to do first is I'm just going to take your temperature, if that's okay. Just to make sure that we don't have any fevers going on. Alright. Okay, and if you can just open up your mouth for me. Okay, good. We'll just hold it there until it's done. Okay, and are you allergic to anything? Okay. You can just nod or... Okay, we'll have a look at that. Okay, so it's about 36.3, which is in the normal range. Have you been sweating at all? Sometimes, okay. And when does that usually happen? During the night, right, okay. Okay, so your skin colour is a little bit pale. You haven't been vomiting at all. Right, I'm just going to check your glands. So I'm just going to come a little bit closer and just come to your glands on your neck here. Okay. So your glands are up on your neck. Right. And it's a little bit sore when I press there. Just a little bit? Okay. And how about here? It's okay? Alright. Okay. Doing well. Okay, so we'll just note that down that your glands are definitely up. Okay, thank you. So seeing as though you've been coughing, I'm going to check your heart rate first, because your heart rate can elevate quite a lot when you're sick, and especially when you're coughing. It's just pumping more blood into your heart as we cough, and also because we're trying to fight off an infection as well. Okay, so if you don't mind, I'm just going to lift up your shirt, okay? And I'm just going to listen to your heart to make sure that everything is running smoothly. Okay, so it might just be a little bit cold, I do apologise. So I'm just going to come a little bit closer, and I'm just going to place this on here. And we're just going to listen to your heart. So if you just breathe normal. Okay. And whilst I do this, I'm trying to listen to see if there's any murmurs as well. Okay, it's all sounding really good, and I'm just gonna go place it on here, and we'll just have another listen. Okay, sounds relatively normal, there's no tachycardia. It's going quite fast, but not, I'd say it's about 100 beats per minute, so there's nothing to worry about there. Okay, right, and I'm just going to go around to your back now, and I'm going to get you to take in some nice deep breaths in for me. And I'm just going to listen to your lungs and make sure that we don't find anything like pneumonia, any wheezing, anything like that, anything suspicious that might indicate that you might have something like that. So I'm just going to go round to the back, and I'm just going to place this first here. Now I want you to take some nice deep breaths for me. Perfect. And a nice deep breath in again, and if you can just hold it. 1, 2, 3. Okay, perfect. And I'm just going to place the stethoscope here, and I'm going to do the same thing. If you can hold in for me, nice deep breath. Very good, and keep holding it, and breathe out. And I'm just going to come over here now, and if you can please breathe in for me again, and breathe out. And now I want you to just breathe normally. So as the stethoscope hits your skin, if you can just breathe normally for me. Good, and here. Very good, and just around here, and just the last one. Perfect. Thank you. I definitely can't hear any wheezing, which is a very good sign. You don't suffer from asthma or anything like that. Okay, have you had any shortness of breath with this cold? Nope. Good. And are you finding that you're suffering with any headaches? Yes. And are you taking anything for that? Any paracetamol? You are? Okay. And how many do you take at a time? 2? Okay. And do you find that they're working for you? On and off? Okay, so I might prescribe you with some better ones. We can have the nighttime and the daytime tablets. It just might help you to fall asleep a little bit more. It can make you feel a little bit drowsy at nighttime because they have a little bit more specific things in them. But I'm perfectly happy with your lung sounds and your heart rate. It's elevated. But that's just how it is. Okay, right, so I'm going to go onto your mouth now. Okay, and I'm just going to shine a light, and I'm just going to press this onto your tongue. Okay, so I just want you to give me a nice wide open mouth. Good, and open wide. Okay, and I'm just going to have a look with the light, because if you've been coughing a lot, there's actually going to be quite a bit of redness. Okay, just having a look here. Okay, so you can definitely tell that you've been coughing quite a lot because it's quite inflamed. Right, but I don't see any indication of any fluids or anything that are coming out here. It just looks a bit raw. Right, and are you taking anything for that? Okay, so ordinarily you might want to go to a chemist and just get something to gargle with. You can usually get coughing medicine, but I'll probably just prescribe you with just some lukewarm water with just some salt in it, and just gargle in it and see if that helps first. Okay, it's just there's a lot of things you can buy at the chemist that don't really work. It's just, it's sort of a marketing scheme. I mean, don't get me wrong, some do work, but it's usually over-the-counter stuff. So just be careful with your money with that. I would just try the salt and the warm water first. Okay? Perfect. And I'm just going to get you just to open up your mouth again for me. Lovely. And if you can just go, ah. Okay, I'm just going to have a look at your tonsils. Right. Perfect. Looking very good, apart from just quite a bit of redness. Are you finding that gets quite itchy? Yep. Okay. All right. Thank you. So whilst we've done I'll just pop this in the bin, sorry. So whilst we've looked at your throat, I'm going to have a quick look at your ears. You might find sometimes you might have a scratchy throat, and you might push your tongue against the back of your throat and you can feel it in your ears, and that's because your ears, nose and throat are all connected. So you'll be able to feel bits and pieces there. I get it quite a lot when I get a cold. It's very annoying, but it's just how the cold is, and it's just how our body works, and it's quite interesting when you can sort of feel it. It's just not nice when it's itchy. So I'm just going to use my otoscope here, and I've got a magnifying glass right here, and that just allows me to see deep into your ears. And we're just going to have a look again if there's any impacted wax, any signs of fluids, any infection, redness, and we'll just have a look. Okay, and this one's got a special little light on here as well, like this. So I'm just going to have a look. Just going to go in a little bit deeper here. Okay. Right. So I can see the eardrum and the canal. A little bit of earwax in there, but it's not impacted. And there's been no pain in your ears, no earache. Okay, so I'm happy with that. Perfect, and I'm just going to come to the other side now, okay? So I'll just have a look. So I'll just put this up here. And here we go again. We're just going to go in nice and deep into the ear canal. Okay, it's looking nice and clear. Nice earwax. No signs of fluid or redness. Okay. Okay, and I'll just pop this out now. Perfect, thank you. So that's all looking great. Now I just want you to tilt your nose up, okay? And I'm going to have a look inside. So you're finding that you're quite runny at the moment? Yeah. Are you taking anything for that at all? No? What about blocking? Are you finding it's quite stuffy in there? Not just yet. So you might find that it is going to be very blocky. There is some sinus medication that you can take. You can just get that either over the counter or just on the shelf. It's up to you what you'd like to do. And that can really help just to clear your nose just for a couple of hours. So it's just about 2 sprays in each nostril, and then it should clear up. Okay, so that might be something you might want to look into. So I'll just get you to lift up your nose for me. Perfect. And I'm just going to have a look. Okay. Just going to peep in a little bit better. And just on this side. Okay. And just going to lift up your nose just so we can have a little bit of a better look. Okay, looking a little bit dry in there, so it'd be good to get that spray so it can moisturize that area. Okay. Okay, perfect. Thank you. Now, if you can just hold onto one nostril and breathe in. Okay, and just having a little listen. And just on the other side. Perfect. Thank you. So there's no obstruction in the ears. So I'm just going to have a little bit of feel around your jaw and on your sinuses, okay? Because that might, I just want to know if your headache usually relates around the front or the back or the side. Okay, so a bit of both. Right, so I'm just going to have a feel at your jaw. Some people might get a little bit of jaw pain. Okay. Does that feel uncomfortable at all? Nope, that's good. And the other side. Okay. Great. Did a very good job. So I'm just going to just palpate all around your eyes and just on your eyebrows. We're just going to see if there's any pressure there. So just right here. Okay. How does that feel? Pressure? Okay. I'm just going to go under the eyes now. You can close your eyes if you'd like to. Okay, and just on top of your eyebrows and just in your T section. Okay. Pressure there. Okay. And what about here? Same again. Okay. All right. Now, are you finding that you're having any muscle aches at all? Sometimes? Okay. Right, so we're going to have a look at your eyes. And we're just going to use the light again. So I use both lights on the autoscope. Just pop that here. And both with my pen light. So I just want you to take a look at the man on the wall. And I'm going to come in with my light, okay? So you can blink as much as you like. And if it gets too uncomfortable, please let me know. Okay. So I'm going to come a little bit closer for this as well, okay? And we're just going to go in with my light here, and I'm just checking your dilation in regards to your pupils and making sure that they're all working fine. I can see that you do have a bit of runny eyes, and this has just come off the wall, so I do apologise. On there. There we go. So we'll just go back at looking at the dilation of your pupil again. Okay, good. And just on the other side, just going to have a look and with the light. Perfect. Doing really well. Okay. Good. Perfect. Now I'm going to use the autoscope now, which is what I used in your ear. I'm just going to come a little bit closer to your eye because I'm going to have a look at the back of your eye with the magnifying glass. So it's going to be quite bright, but it'll be completely fine. So if you can again look straight ahead, I'm going to come in close and that should be fine. Okay, so just a little bit close, okay, and the light's just going to come in. Okay. So I can see blood vessels and it's looking clear. A bit closer. Okay. It's also looking good, just a little bit of watery eyes, that's all. Okay. And I'm just going to have a look in the other eye. So I'm just going to come a bit closer. If you just keep looking ahead, just going to have a look. Okay, good. And again, I can see the back of your eye retina. And the vessels. Perfectly fine as well. Great. Thank you very much. Now, the last thing I'd like to do with the light is I want you just to follow the light with your head staying still. Okay, and I'm going to come to the side here and just watch. So if you can just follow. Doing a wonderful job, thank you. And if you can just stare at the light now. Perfect. And I'm just going to draw it in. Okay. And back out. Perfect. Good job, thank you. Okay, eyes looking good, a little bit watery, but that's a given, especially when you have a cold. Okay, so what I'd like to do now is I'd just like to talk to you about some things that may help, okay? So you just need to make sure that you are washing your hands thoroughly, about 20 seconds, making sure that you're really getting into all areas of your hand. Lots of people miss out their thumbs, so you just want to make sure that you really get into your thumbs and just all around the nips, okay? There's a lot of naps and crannies and things like that, so you just want to make sure that you are properly washing your hands and also rinsing your hands, okay? And that goes for when you're at home and when you're out. It's up to you whether or not you want to wear a mask. Really, you're just protecting others from getting the cold and also protecting yourself from giving it to others. You need to make sure that you're drinking plenty of fluids. So do you drink quite a little bit of water? You don't? That's completely fine. There's all sorts of different ways you can get hydrated. Of course, water is the number one thing that you really want to drink. It nicely flushes things out of your system. If you want to add lemon or lime to it, or even an orange, that can help with flavour. There's another one as well, which is here, and I'm going to give you these, okay, to take home with you. This one is a Hydrolyte. This is just a lemon lime. It's electrolyte tablets, so this is really going to help you in managing fluids and making sure that you're getting the right intake. So you just have to have it with just a glass of water and just take little sips at a time, okay? And I'd like you to start using the Vapor Rub. Now this is extremely good, especially if you've got a stuffy nose, and you can also take some hot showers. It's up to you whether or not it's what works for you. So if you want to take a nice sniff of this, it might actually help you with your nose right now. You find that it does? Okay, good. It's quite nice just to smell on its own too, isn't it? So apparently it gives you up to 8 hours relief. I wouldn't really trust that. Everybody's different. The best thing to do with this, and it could help with your cough as well, you might just want to put a little bit of a dab on your throat and on your chest as well. Okay? You'd like some on now? Okay, that's fine. Give me a second. I'll just take some off here now. So if you just like to lift up your shirt, so I'm just going to rub it here, okay? Okay. So you don't need a lot, just enough to cover the surface area. Perfect. And just a little bit here. And if you can just push your neck out. Good. And I'm just going to put it just a little bit around here. Now what you can also do with this rub is you can dab just a little bit on the outer parts of your nose just to see if that gives you any relief, especially at night time. Okay, so I'd like to give you those when you leave. You're more than happy to just stay here for the next 5 minutes. Okay, I'm going to prescribe you some medication. So it's got a tiny bit of codeine in it, which is really going to help make you feel just a little bit better. And as well as that, I know that you're working. I'd like you to take the rest of the week off, so I'm happy to give you some certificate to give to your boss, and that just, it makes you feel a little bit less stressed and more relaxed, and you can sit in bed and drink your fluids. Might be really good to have some chicken noodle soup as well. So those are all things that really do help. Okay, perfect. Okay, well, I'm sorry that I couldn't help you any other way. Really, we just got to ride it out, and hopefully everything that I've given you today will help you recover a little bit better. Okay, perfect. So when you're ready to go out, if you just go to reception, we'll have that medical certificate ready for you. Okay, and if you're having any further issues, please don't hesitate to come back and contact me. I'll be more than happy for you to be my patient again. Okay, lovely. Well, it was very nice to meet you too. Okay then, take care. Bye.